Welcome back, everyone. Just a little nip or tuck to change up the parts you don't love about your appearance. Dr. Sarah Aquina from U of U Health is here in the sponsored interview to sniff out the pros and cons of a rhinoplasty. Doctor, thank you so much for coming.
Thank you for having me.
Let's talk about this. What exactly is rhinoplasty?
So rhinoplasty is typically any surgery on the outer part of the nose. And there's many reasons that we might want to do that. Two of the main buckets in rhinoplasty are functional and cosmetic. So we do surgery for both of those aspects.
In layman's terms, it's a nose job.
Exactly.
Right? And so why would someone want to do this?
So one of the main reasons is that they can't breathe through their nose, and that's the functional aspect. So anyone who has trouble when they're breathing in through either side of their nose, or who has maybe collapse of the outer part of their nose, may need a functional rhinoplasty to help support those areas and remove the parts that are blocking. So this is a patient of mine who's actually undergone a reconstructive and cosmetic rhinoplasty. He was kind enough to show his photos. This is a frontal view, and you can just see after his surgery how improved his nasal dorsum looks. This is a 3/4 view before his surgery, where you can see that rounded aspect of his nose. After surgery, you see how those lines have improved and just look overall better for his face.
And was it for both functionality and looks?
Yes, yeah. So this poor patient had been in actually a significant trauma. So he had had facial fractures and broken his nose. And this was a restorative surgery to, one, improve his breathing, and two, improve the appearance. So in this particular photo, too, you can see how his nostrils were rounded. Now they're a little bit elongated. His nose looks more like a nose. It's recovered its shape. And overall, he's in a better place for that.
And so some other reconstruction is, and he had the narrow of the span of your nostrils, changes the shape or the tip.
Yes, yeah.
Some of those are cosmetic, and reduce or increase the size of your nose.
Yes. Yeah, and for him, you know, he really wanted to improve the overall shape after it had been really crushed from the prior trauma. So the shape and appearance overall got better, in addition to his breathing. He had significant breathing problems before, and now he's much better.
And doctor, whatever the reason it is for rhinoplasty, make sure that you find a board certified doctor.
Yes, yes. So there are many surgeons, of course, that, you know, perform different surgeries, but board certified facial plastic surgeons have had specific training in rhinoplasty, and that includes both functional and cosmetic aspects of it for the most part.
Because I'm sure you have seen patients who need to correct their rhinoplasty. Tell me a little bit about that.
Yeah, so that would be called a revision rhinoplasty. And those can be challenging because from their past surgery, whether they're now having functional issues or are not happy with the appearance of their nose, they may need a revision procedure to fix those aspects. And that may require additional, you know, grafting sources such as rib cartilage or ear cartilage. So it gets a little bit more complicated, and that's why you want to make sure you're going to a board certified surgeon who you can trust to do those things.
I'm sure you've heard some nightmares and some patient stories there.
Oh yes.
So really important to do your homework, and maybe people are surprised that the U of U has cosmetic surgery.
Yeah, and we do, you know, and I think it's great to be at a university setting where you're you're working with trusted surgeons who are trained and ready to help you.
What is the downtime for a surgery like this?
Typically, I tell patients that they'll have a cast and splints in their nose for about 1 week after surgery. Overall, the swelling can actually last 6 to 12 months, so you have to be patient for some of the final effects, but generally within a few weeks you can see the changes both to the breathing and the appearance.
Where can we find out more information and do our homework here?
Yeah, so you're always welcome to go to our university site. We have a specific site at University of Utah for rhinoplasty, and that will have lots more details and information on how to schedule a consultation with us.
Doctor, thank you so much for all of that information. Make sure you are looking for a board certified surgeon for sure.
That's right.
All right, thanks to the University of Utah Health for the sponsored interview.